Well, I think, if we could sort of pick one disease that is the number one cause of death, it's clearly cardiovascular disease, right? So globally and in the United States, heart disease kills more people than any other disease.
Really? How many people die a year?
So globally, about 19 million people die per year of a heart attack.
Heart attack?
Yeah.
Around the world?
Yeah.
Well, 19 million people a year, heart attack.
Yeah. Cancer, number 2, about 12 million. So, it's almost twice the mortality of the next closest disease.
Heart failure, heart attack.
Heart disease, yeah. Atherosclerotic cardiovascular disease.
And is that more on the emotional side of things and stress, or is that more that you just don't have good cardio?
No. I think there's, so the other thing I would point out before we even talk about that is, this is true of men and women as well. So I think there's an erroneous belief that heart disease is a male disease. No, it's the leading cause of death in men. It's the leading cause of death in women. It's the leading cause of death in men in the US and the world. It's just, by every metric, it's the number one bestseller.
What is the main cause of a heart attack, or the main causes?
Yeah, so a heart attack is shorthand for a process where there is an occlusion of blood flow to a significant enough part of the muscle of the heart that a process known as ischemia takes place, and that heart muscle dies.
That's the attack.
Yeah.
The heart muscle dies and there's an attack.
That is the heart attack. And that can be, that can occur in a very small blood vessel, and it can result in a non-fatal heart attack. People can have small heart attacks where not a big enough part of the heart muscle dies. People can also get medical attention quickly enough, and the blockage in the artery that's causing that death can be opened up, right? They can put a stent in there in the emergency room, or you get to the emergency room, they take you to the cath lab and they stent it and give you clot-busting medicine, and it opens it up. And if you do that quick enough, you can get blood back to the area and minimize the damage that takes place. But about 50% of people who have a heart attack die first time. And that's their first sign of heart disease. So they didn't have chest pain before that. It's not like they were having chest pain for years.
Really?
Their first brush with heart disease is sudden death.
Because you hear about these, I don't know how common this is, but you hear about someone that had a heart attack and died on the treadmill who was 45 years old,
That's right.
Healthy, good looking, not overweight, and just had a heart attack and died.
Right.
And you hear these stories. So what is the cause of it happening?
So it's a complex disease, but fortunately, of all the diseases, it's the one we understand hands down the most. Now, that's the good news. The bad news is it's going to take me a minute to explain it, and I'll do my best to not get terribly technical.
You're good.
So it starts with cholesterol, which everybody's heard of. And cholesterol certainly gets a bad rap. Everybody kind of understands cholesterol is bad stuff, but it's important to sort of get the context right. So cholesterol is a substance that every cell in our body makes. It's a very important chemical. It's a lipid, it's a type of fat, but it's important for several reasons. It's the most important building block of the cell membrane. So every one of our cells is like a sphere, and it has this membrane, and it allows the cell to be fluid. It allows the cell to change its shape and have little channels across its surface that allow things like glucose and sodium to come in and out, and all sorts of things like that. So naturally, something that important, the body would figure out a way to make it, and the body does. It makes a lot of cholesterol. Now, cholesterol, because it's a fat, doesn't dissolve in water. So if you've ever made salad dressing and you dump oil and mix it with vinegar, you know that they separate completely. So there's a bit of a challenge the body has to solve for, which is how do you transport this fat throughout the body? You have to put it in the highway. Well, the highway is our circulatory system. And even though it might not look like it when you get cut, if you look at your blood, it's just water. Your blood is just water. The reason it's so red is there's a bunch of red things in it, like red blood cells and platelets. But if you've ever seen what happens to your blood when you put it in a tube and spin it in a centrifuge, it separates immediately. So all the red stuff goes to the bottom, and then you can see it's basically just clear stuff. It's just basically water called plasma. So we can't move this cholesterol through the body because it's water insoluble. We need a trick. And the trick is the body made these little spherical submarines that are water soluble to put the cholesterol inside. And those little spherical submarines are called lipoproteins. Okay, those lipoproteins have different densities. So there's high density lipoprotein, a low density lipoprotein, a very low density lipoprotein. And the low density lipoproteins and the very low density lipoproteins, LDL and VLDL, people call those good and bad cholesterol, but that's a bad name. It's the lipoproteins that are the problem. Those things get stuck in artery walls. And in particular in the coronary artery system, which are very small arteries, this becomes especially problematic. So these lipoproteins, they get up into the artery wall. A lot of the times they come back out and nothing goes wrong. But often enough they get stuck in there. And when they get stuck in there, the body reacts, I guess, appropriately in that it thinks there's a foreign invader. And it kicks off an immune response. And it sends immune cells to the artery to go and eat or ingest, or what's called phagocytose, those cholesterol particles. And when it does that, it kicks off an enormous inflammatory cascade that ultimately results in the body trying to repair the damage it's causing. All the while, what it's doing is setting itself up for a disaster. It builds this thing called a plaque, and eventually when that plaque ruptures and all the platelets that are clotting cells come to repair it, that's what stops the blood flow. So the heart attack is caused by one of these plaques rupturing and the blood flow getting stopped.
Got it. Okay.
So knowing that, what would you do? So what are the biggest drivers of that? The first is the number of those lipoproteins. So the more of those low density lipoproteins you have, the greater your risk of this happening.
The more of those you have, the greater the risk.
That's right. The more of, you can think of it as kind of like a random process. So, you know, the more cars going down the road, the more chance that one of the cars is going to bump into a curb.
Sure.
Okay, so fewer cars on the road is better for everybody.
So how do we minimize the cars?
So there are some dietary ways to do it, and there are some pharmacologic ways to do it. And you know, how much of each you need depends on the situation you're in. But the reality of it is, if you really wanted to prevent heart disease, you know, it's funny. I think almost everybody would benefit from lipid-lowering drugs to take that lipoprotein down as far as possible. And I'll explain why in a moment. I'll come back to it. The second thing that drives cardiovascular disease is blood pressure. So elevated blood pressure causes a mechanical stress on those artery walls, and it makes them more susceptible to those little lipoproteins going in. So you can think of it like the integrity of the wall is what keeps those lipoproteins out. If you damage the integrity of that wall, more and more of them get in. And the third thing is smoking.
And that's blood pressure.
Yes, high blood pressure. The higher your blood pressure, the more stress you're putting on that wall, the more shear stress.
And how do you decrease blood pressure? What's the efficient ways to do that?
I mean, weight loss is an enormously efficient way to do it. Exercise is an important way to do it. In some people, sodium reduction matters if their kidney function isn't perfect.
Okay.
And if all else fails, I mean, sleeping adequately does it. So correcting things like obstructive sleep apnea can help. And ultimately pharmacology helps if none of those other things work. And then the third one is smoking. Yeah. So smoking is an enormous driver of cardiovascular disease, and it has a chemical irritant on that same thing. So smoking sort of chemically irritates the artery wall. So basically all roads to cardiovascular disease have to do with the integrity of the artery wall and the ability of the lipoproteins to get in and do their damage.